Ever notice how your stomach can look and feel different after a stressful email, a tense meeting, or a long drive, even if you ate the same foods as usual? That stress bloat is real for many people, and it's not just in your head. Stress changes how your gut moves, how sensitive it feels, and even how much gas you perceive. It can also shift your breathing and posture in ways that make your belly feel tighter. And when your nervous system is on high alert, your digestive system is often the first place you notice it. The key idea is simple. Your brain and your gut are in constant two-way communication. When your brain detects threat, it can temporarily reprioritize digestion. That can lead to slower transit, trapped gas, and a distended feeling. In the next few minutes, you'll get a clear mental model of why this happens and what actually helps in real life. Moving to slide 2. To understand stress bloating, you need the gut-brain axis. Think of it as a communication network between your brain, your gut nerves, your hormones, and your immune system. One major highway is the vagus nerve, which carries signals in both directions. Another is your stress system, often described as the HPA axis, which releases cortisol and related hormones. These signals change digestion in practical ways. They can alter stomach emptying, small intestine movement, and how the colon contracts. They also influence how much fluid your intestines hold and how strongly your gut reacts to normal stretching. So bloating can come from mechanics, like slowed movement and gas handling. But it can also come from perception, meaning you feel more full or tight at the same level of distension. That's why two people can eat the same meal. One feels fine, the other feels swollen. Their nervous systems are interpreting the gut differently. Moving to slide 3. One of the fastest ways stress creates bloating is by changing motility, meaning the timing and coordination of gut movement. Under stress, your body shifts resources toward fight or flight. Digestion is not the priority. For some people, the stomach empties more slowly. That can feel like heaviness, early fullness, or food sitting there. In the intestines, movement can become irregular. Instead of smooth waves that push gas and food along, you can get stop-and-go patterns. That's a setup for trapped gas pockets. In the colon, stress can either speed things up or slow them down, depending on your baseline and the type of stress. That's why one person gets stress diarrhea and another gets stress constipation. Both can come with bloating. Constipation can increase fermentation time and gas. Diarrhea can increase urgency and cramping, which also makes the abdomen feel distended. The takeaway is that stress disrupts rhythm, and your gut is very rhythm-dependent. Moving to slide 4. Bloating isn't only about how much gas you have. It's also about how your gut senses normal pressure. Under stress, your nervous system becomes more vigilant. That can turn up the volume on sensations that would normally be background noise. Researchers often describe this as visceral hypersensitivity. Basically, your gut nerves report too much from not that much. A normal meal stretches the stomach and small intestine a bit. A normal amount of gas forms during digestion. If your system is calm, you barely notice. If you're stressed, the same stretch can feel uncomfortable, tight, or even painful. This is especially relevant for people with functional gut disorders, like IBS, where sensitivity is already higher. But you don't need a diagnosis to experience it. Stress can temporarily raise sensitivity in anyone. The practical implication is important. You might chase the perfect diet thinking the problem is only food, but sometimes the bigger lever is lowering the threat signal your nervous system is sending to your gut. Moving to slide 5. Now let's talk about breathing, because it's an underrated cause of stress bloating. When you're stressed, you often shift into shallow chest breathing. You might also swallow more air without realizing it, especially if you're talking fast, chewing gum, sipping through a straw, or eating quickly. Swallowed air is called aerophagia. Some of it comes back up as burping, but some travels down and adds to intestinal gas. Stress can also change how your diaphragm and abdominal wall coordinate. Ideally, when your belly expands after a meal, your diaphragm and abdominal muscles adapt smoothly. Under stress, some people brace their abdominal wall, like a subtle suck-in. That can push pressure downward and forward, making the belly look more distended, even without extra gas. This pattern is sometimes discussed as abdominophrenic dyssynergia. meaning the diaphragm and abdomen are out of sync. You don't need to memorize the term. Just remember, stressed breathing and bracing can create real, visible bloating. Moving to slide 6. Stress also changes your gut's chemistry and barrier function in subtle ways. Cortisol and related stress signals can influence how much acid your stomach makes, how much mucus your gut lining produces, and how permeable the intestinal barrier becomes. The phrase leaky gut is often used online, sometimes too broadly, but in research, increased intestinal permeability is a real measurable phenomenon in certain contexts. For bloating, the more direct issue is that stress can promote low-grade inflammation and alter immune signaling in the gut. That can affect motility and sensitivity, which brings us back to the same two bloating pathways. Stress can also shift bile flow and digestive secretions, which changes how fats and carbs are processed. None of this means stress damages you after one hard day. It's more about repeated activation without enough recovery. If your baseline stress stays high, your gut environment can stay reactive, and a reactive gut tends to bloat more easily, with smaller triggers. Moving to slide 7. Another big piece is your gut microbiome, your community of microbes that help break down food. Stress can change the microbiome indirectly by changing sleep, food choices, and gut motility, but it can also change it directly through stress hormones and immune signaling. When motility slows, microbes have more time to ferment carbohydrates. That fermentation produces gas. If motility speeds up, digestion can be less complete, and more material reaches the colon quickly, which can also increase gas and urgency. Stress can also make you more likely to eat in a rushed way. Less chewing means bigger particles reach the gut, which can increase fermentation. And if you're stressed, you might reach for more ultra-processed foods, sugar alcohols, or carbonated drinks. Those are common bloating triggers even without stress. So stress isn't only a mind issue. It changes the environment the microbes live in. The result can be more gas production, different gas handling, and more sensitivity to that gas. Moving to slide 8. Let's separate two words people mix up: bloating and water retention. Bloating is usually about gas, pressure, and distension inside the gut. Water retention is fluid stored in tissues, often influenced by salt intake, hormones, and inflammation. Under stress, both can happen, and they can stack. Stress can change aldosterone and cortisol patterns, which influences sodium and fluid balance. Stress can also disrupt sleep, and poor sleep is linked with changes in appetite hormones and inflammation. Then you might eat saltier foods, drink less water, or move less. All of that can increase the puffy feeling. Meanwhile, inside the gut, stress is still affecting motility and sensitivity. So you can feel bigger for two different reasons at the same time. The fix depends on which one is dominant. If it's mostly gut bloating, the best levers are motility, breathing, and trigger management. If it's mostly fluid, the levers are sleep, sodium patterns, hydration, and movement. Many people have a blend, so you use a blend of strategies. Moving to slide 9. So what actually helps when stress bloat hits? Start with the fastest nervous system downshift you can do anywhere: slow nasal breathing. Aim for longer exhales than inhales, because that tends to nudge the body toward a calmer state. Next, reduce air swallowing. Eat a little slower, chew more, and skip gum and straws when you're already bloated. Then add gentle movement. A short walk can help gas move through the intestines and can also reduce stress hormones. For many people, warmth helps too, like a warm drink or a heating pad, because it relaxes smooth muscle and reduces the guarding response. If constipation is part of your pattern, focus on regularity, consistent meal times, hydration, and fiber that you personally tolerate. If diarrhea is your stress pattern, simpler meals and smaller portions can reduce urgency. None of these are magic. They're small levers that work together by restoring rhythm and reducing sensitivity. Moving to slide 10. If stress bloating happens a lot, the goal is to reduce your baseline load, not just put out fires. One powerful anchor is meal regularity. Your gut has predictable reflexes, like the gastrocolic reflex, where eating stimulates colon movement. If your schedule is chaotic, motility often becomes chaotic too. Another anchor is sleep. Poor sleep increases stress reactivity and changes hunger signals, which can lead to larger, later meals that bloat more easily. Next is caffeine timing and dose. Caffeine can increase gut motility and anxiety in some people, and both can worsen symptoms. Also pay attention to carbonated drinks and sugar alcohols, because they commonly create gas. Then consider your personal FODMAP sensitivity. FODMAPs are fermentable carbs that can cause gas in some people, especially under stress. You don't need extreme restriction, you need pattern recognition. The long game is building a routine that keeps your nervous system and your gut in a steadier rhythm most days. Moving to slide 11. A common question is whether stress bloating means you have a food intolerance. Sometimes yes, often no. Stress can make you react to foods you normally tolerate because it changes motility and sensitivity. That can look like an intolerance, but it's more like your threshold got lower. Another confusing area is probiotics. Some people feel better with certain strains, some feel worse, and many feel no change. If you're very bloated, adding more fermenting bacteria can backfire at first. Fiber can be similar. Fiber helps many people long-term, but if you increase it too fast, gas can spike. So the smarter approach is gradual changes and tracking. Also consider that bloating can come from non-food triggers like pelvic floor tension, poor posture, or chronic mouth breathing. The point is not to blame stress for everything. It's to recognize it as a multiplier. When stress is high, small dietary choices have bigger consequences. When stress is lower, your gut usually has more flexibility. Moving to slide 12. Let's make this practical with a simple self-check you can do without overthinking. When you feel bloated, ask 3 questions. First, did I eat fast, talk a lot while eating, chew gum, or drink carbonation? That points to air and gas handling. Second, what's my stress level from 1 to 10, and where do I feel tension? Jaw, chest, belly, shoulders. That points to nervous system and bracing. Third, what's my bowel pattern in the last 2 days? Constipation, normal, or looser than usual? That points to motility direction. Once you know which lane you're in, pick 1 or 2 actions, not 10. If it's air and tension, do slow breathing and a short walk. If it's constipation, prioritize hydration and a consistent mealtime, and consider a gentle fiber you tolerate. If it's loose stools, simplify the next meal and reduce caffeine. This approach keeps you out of panic mode, which is often the hidden fuel for stress bloat. Moving to slide 13. Finally, it's important to know when bloating deserves a closer look. Occasional stress-related bloating is common, but persistent or worsening symptoms should be discussed with a clinician, especially if you notice red flags. Those include unexplained weight loss, blood in stool, persistent vomiting, fever, anemia, severe pain that's new for you, or symptoms that wake you from sleep. Also pay attention if bloating is paired with significant changes in bowel habits that don't settle. Conditions like celiac disease, inflammatory bowel disease, infections, or gynecologic issues can sometimes present with bloating, and they need proper evaluation. If you're dealing with chronic bloating, it can also help to ask about constipation patterns, pelvic floor function, and whether reflux or swallowing air is part of the picture. The big message is balanced. Stress can absolutely drive bloating through the gut-brain axis, and you can often improve it by working with your nervous system and your habits. If you want more videos like this, subscribe. Comment with your experience. When you're stressed, do you bloat more from constipation or from urgency? A or B? This information is not a substitute for medical advice. Optimize your biology, not just your diet.